Question number 1. Which of the following palliative procedures is usually performed when the ureters are obstructed by a tumor? Option A. Transurethral resection. Option B. Cutaneous ureterostomy. Option C. Pilostomy. Option D. Percutaneous nephrostomy. Answer option B. Cutaneous ureterostomy. Rational. Cutaneous ureterostomy surgeon attaches the ureter to the surface of the abdomen, where urine flows directly into a drainage appliance. This is done when ureters are obstructed by a tumor. Transurethral resection is conducted in a very early stage of bladder cancer. Pilostomy or percutaneous nephrostomy is usually performed to prevent obstruction in patients with inoperable bladder cancer. Question number 2. Urinary diversion procedure where a segment of ileum is constructed as a conduit and the ureters are attached to it and opened through a stoma on the abdomen is called. Option A. Ileal bladder. Option B. Indiana pouch. Option C. Neobladder. Option D. Florida pouch. Answer option A. Ileal bladder. Ileal bladder, also known as ileal conduit or ureteroileostomy. In Indiana pouch or Florida pouch, a reservoir is created in the ileum and then ureters are implanted into the side of the diversion. In neobladder, a bladder is created which empties via a pelvic outlet to the urethra. Question number 3. The two most common complications of urethral trauma are option A. Urethral strictures and impotence in men. Option B. Bladder strictures and impotence ureters. Option C. Impotence among men and ectopic uterus. Option D. Impotence among men and megaureters. Answer option A. Urethral strictures and impotence in men. Most common complications of urethral trauma are urethral strictures and impotence among men due to damage of corpora cavernosa of the penis, blood vessels or nerves supplying this area. Ectopic ureters, megaureters or abnormal dilation of the ureters are congenital anomalies and cannot be the effect of trauma. Question number 4. The most common cause of urinary retention in women is option A. Urethral stricture, option B. Spinal cord injury, option C. cystocele, option D. detrusal failure. Answer option D. detrusal failure. Rational. Detrusal failure means failure of the bladder to contract is the most common cause of urinary retention in women. Urethral stricture is a common cause in men. Spinal cord injury, if occurs, can cause urinary retention in both men and women. Cystocele is another common cause of urinary retention in women. Question number 5. The two major problems caused by bladder diverticula are option A. Distended bladder and urinary tract infections. Option B. Urinary tract infections and malignancies. Option C. Malignancies and obstruction. Option D. Urinary tract infections and ureter stricture. Answer option B. Urinary tract infections and malignancies. Rational. Diverticulum is pouch or sac resulting from the herniation of the mucous membrane lining caused by weakness in the muscular wall. Bladder diverticula can give rise to two major problems. First one, urinary tract infections resulting from stasis. Number 2. Malignancies which may develop due to chronic irritation by persistent infection. There is no stricture in the ureter.